Transmission of important messaging. Above all, we need to communicate a clear message to young people that they should go home and stay as safe as possible. The only caveat to this, the need for social care, social work oriented intervention, where workers judge there are safeguarding issues and where home may constitute a danger. You should communicate directly with colleagues in social care and aim to support young people under their direction. We are in unprecedented times, and the idea of telling young people to go home may seem at odds with the historical desire to support them and encourage them to value public space. Indeed, this has echoes of social control, and we would typically resist this. However, in the context we have now, it is vitally important to keep as many young people as safe as possible by asserting the message, go home. To reiterate again, the only exceptions are those young people most vulnerable where we judge home is not a safe place. It is more important than ever that the specific role and professional boundaries of detached youth workers are informed by good decision making and both generic and dynamic risk assessments. As part of this process, we should seek support from local multi-agency working groups before detached youth work takes place. Time needs to be given to develop risk assessments prior to street-based work. Authority to undertake work should be secured only with managerial guidance. Reflect on your limitations and your abilities. Treat your working environment as a protective factor. That said, while work in public and other open spaces has fewer risks than indoors, risks exist nonetheless. The space we work in should remain as much as possible outdoors. This affords the possibility of working at a safe distance and makes possible putting into practice safe working protocols. Young people should be strongly encouraged to keep a distance from one another, follow wider hygiene advice such as avoiding physical contact, and catch it, bin it, kill it practices in relation to coughing and sneezing. Here, the detached workers' kit bag will need to be supplemented to include tissues and hand sanitizer and water. Remind them to wash their hands when they get home. Model good behaviour, especially the 2-metre rule. Young people will learn as much from this as from what you say. Workers should review and update necessary practice guidelines and policies in this new context and continue to do so on an ongoing basis. Furthermore, dynamic risk assessments are essential. You should consider the location in which you are working, the size of the group you feel it is safe to work with, frankly, the smaller the better, proximity to other members of the public, and be vigilant and responsive to any symptoms those present may display. Any young people displaying Covid-19 symptoms should be told to go home. Advise them to contact health services. Check they do. Ultimately, you may need to withdraw from the situation and advise young people to do the same. There are accountability issues too. We are moving into an arena of targeted work with a global dimension. Perhaps more than ever, we'll be open to public scrutiny, particularly if we work in a way seen as encouraging young people to congregate on the streets and outdoors and in public space. We must try to avoid this. In all circumstances, follow governmental and Public Health England advice and that of the local authorities or organisations you work for or are working with. Ultimately, detached workers need guidance notes and protocols for the engagement if they are going to work. These are as important as the measures taken to keep safe and reduce transmission.